Good afternoon, everybody, and thank you for joining us for Heart Love Places roundtable, I guess, concerning COVID-19 and the vaccine. So we thank you for joining us. If you're not able to join us, we will be showing it on Facebook after it is completed. We want to thank Connie Palmer, who is the CEO of Outreach Community Health Centers, who is partnering with us and to help us get information out to the community. So what I'm going to do as the host, I guess, or the MC, I will introduce each speaker. After I finish introducing them, they will do their presentation, and then I'll introduce the next person. They'll do their presentation and so on, and then we'll take questions at the end. So the first person up is Dr. Deborah Boateng. She's an advanced nurse practitioner who graduated from UWM Graduate School in 2016 with a Doctor of Nursing practice degree with a specialty in family practice. She currently works for Outreach Community Health Center at 210 West Capitol Drive since 2017. She's also an adjunct clinical instructor at UWM for nurse practitioner students. Her passion is health education for her community and to help improve health outcomes. Her philosophy of care is, my philosophy of care is to view each patient as a unique individual, taking into consideration other social factors that affect the individual's well-being. I believe that after an encounter with a patient, he or she should leave with limited or no questions on his or her mind. The patient should be empowered to help make informed choices and to take control of their health. And that is exactly why we're here today, Doctor. Thank you so much. I turn it over to you.
Thank you. Okay, thank you. It's a pleasure to be with all of you this afternoon. I'm going to talk a little bit about what the COVID is, and then my colleague, Dr. Mensah, will talk about the vaccines, and then Dr. Linn will continue from there. So we can start with the slides, please. Okay, next slide, please. Okay, next slide, please. Okay, so what is COVID-19? I intentionally put the abbreviations and what they mean on here because of some of the myth that is going on. So throughout the presentation, we will be addressing some of the myths as well. So the CO in the COVID stands for corona, the VI stands for virus, and D stands for disease. The reason why I put this down is that I saw a video that said the COVID is certificate of vaccination identity something. So just to clear the air, it stands for the coronavirus disease. Just to let you know, there are so many types of human coronavirus, which usually will cause upper respiratory illnesses. So this is, when we hear of coronavirus, we think this is like new. This is not new. We have some human coronavirus. Can we go to the next slide, please? What is unique about this one is, so this is how the coronavirus looks like, really, really beautiful. That's what I say. Next slide, please. Okay, so what makes this one unique, which we'll see in the slides that follow, is that the virus transmitted from an animal to a human being, which usually we don't really see that happen often. And for the coronavirus, we all know it's transmitted, or it's spread from person to person. The 19, again, we'll look at it in the next slide, is a new coronavirus that has spread throughout the world. That's why we're calling it a pandemic. And again, what makes it unique is that it's kind of spread from animal to human, which we don't see very often. Next slide, please. Okay, I think I've talked about this. So far there are 3 coronaviruses that transmitted from animals to humans. One that we're dealing with is the current one. 2002, 2012, we had the SARS-CoV, and then the Middle East Respiratory Syndrome coronavirus, which also was like a big issue in the public health institution. Can we go on, please? Okay, so the symptoms can range from mild to severe symptoms. Next slide, please. And usually the symptoms will appear 2 to 14 days after you're exposed to the virus. This is really important because we see people come for testing, and when you ask them when they were exposed, they'll say, I was exposed today. Probability that is going to be negative is high. So we recommend when you're exposed to it, like you wait like about 2 days, 2 to about 5 days, and then we can do the testing for you. So you see that the symptoms listed here are kind of symptoms that mimic symptoms from other illnesses, especially the flu, the fevers, the chills, the shortness of breath, fatigue, headaches, sore throat, runny nose, diarrhea. You lose your sense of taste and your sense of smell as well. Next slide, please. Okay, so when you see these particular symptoms, then you need to either call 111 or seek an emergency medical care. Trouble breathing, persistent pain in the chest, confusion, inability to stay awake, and bluish lips or face, then you know you're in a danger zone. Let me say this. If the virus was just to cause the fevers, the chills, the headaches, and that was it, we wouldn't be so much worried or panicky about it. But can we go to the next slide? I think that what I'm saying will be on there. Okay, let me finish what I'm saying and then I can go to this one. So if it was just those symptoms, then we will just we will not panic about it. But what we've found is that people get aftermath respiratory issues, like severe breathing issues, that they have to deal with it for months. And we know that the virus is killing people. So that is one main reason why we're kind of so concerned about what should we do to help combat this virus. Next slide, please. Which this we know already is spread through droplets, usually from the nose when people cough or sneeze. That's why we're encouraging that wash your hands, make sure you're cleaning up surfaces. And these are not information that is new. We know all this already. So a summary, we're saying that the coronavirus is caused, the COVID-19 is caused by the coronavirus, and you can get it through contact with other people, and usually you're getting respiratory symptoms, and the symptoms range from mild to severe, and the symptoms usually appear within 2 to 4 days. Some people will ask, then what is the difference between this and the flu? Why are we so much concerned about this one? Remember, the symptoms for this COVID-19 is lasting more days than what the flu, how long the flu will last, and it's also causing long-term respiratory issues in people, and it's killing people. So that is one reason why. Not that the flu is not killing people, that the COVID-19 is doing more, causing more death than than the COVID-19. With the flu also, you realize that your symptoms as the days go by will be declining or will be reducing. But with the COVID-19, as the days go by, it seems your symptoms get worse and worse. So at this time, I will hand over the baton to Dr. Mensah, and she will talk about the vaccine. Again, why do we have to do something about this COVID-19? Why did the vaccine even come about? Do we even need it? Is it safe?
Dr. Mensah, before you start, let me just introduce you. Dr. Mensah is a graduate of Concordia University School of Pharmacy and Marquette University. She's an adjunct clinical instructor in pharmacy at Concordia and MCW. Her practice goals: providing culturally competent medication management therapy for all patients and educating patients to drive their overall health based on evidence-based knowledge. Her ultimate goal is to attain equal medication access and overall health equity and outcomes among all Americans and beyond. Welcome, Dr. Mensah.
Thank you. Thank you so much. It's an honor to be here because I actually do believe that doing my due diligence and educating all of us, for that matter, we will be able to make informed decisions and choices, and hopefully we can all emerge through this pandemic, hopefully soon. So if you could kindly bring up our slides, we'll jump right into the vaccines and gain some knowledge and make some informed decisions. Okay, the next slide, please. Great. So as many of us may know, we now have 3 vaccines authorized, not fully authorized as full vaccines, but authorized with emergency use, meaning they haven't gone through the entire 10 years that would usually take a drug, but has gone through the processes that a regular drug would go through. So we are blessed to have these. So Johnson & Johnson actually just got approved. I was gonna keep it real short, didn't want to go too much into it. So just that we need. And Moderna and Pfizer, as we all know, we've had some experience with that for at least 2 months, 2 to 3 months now. So for Moderna and Johnson & Johnson, the recommendation is to be at least 18 years old to be able to receive those 2. We really need to keep that in mind. So if you are less than 18 years old and you show up at a facility that's only administering Moderna or Johnson & Johnson, please be aware. Pfizer, on the other hand, is 16 and up, so that's great. We have options for 16-year-olds, but nothing below that. So I just wanted to put the word out there. Someone may ask, when am I completely immune? So for these 3 vaccines, especially for Moderna and Pfizer, 2 weeks after your second shot is when you're considered fully immune. So you are fully vaccinated, you are not fully immune. 2 weeks after, that's when you're actually fully immune. But for Johnson & Johnson, it's a range. So we are keeping on the higher end, just to err on things, 2 to 4 weeks. After that 1 shot, because Johnson & Johnson only requires 1 shot, whilst the other 2 require 2 different shots. If you could please bring up the next slide. Okay, so this picture actually looks a little much, but the takeaway here is just a few points. It's just comparing the 3 different manufacturers, if you will. Pfizer, so Pfizer actually, you do need 2 doses, as I mentioned, but the difference between Pfizer and Moderna is that Pfizer, you are going to be receiving the 2 doses 21 days apart, so 3 weeks apart. And as I mentioned, 2 weeks after this, 3 weeks apart, then you are fully immune. Whereas for Moderna, you're going to be waiting 28 days to be able to go back for your second shot. The new vaccine, Johnson & Johnson, only requires 1 shot. So there's no waiting period for that. But remember, you're going to have to wait at least 4 weeks to be considered fully immune. And someone may ask, is there any difference as to how much immunity you are gaining? amongst these three, all three are actually fully efficacious. So even though we see 95% efficacy with Pfizer versus Moderna 94 and Johnson & Johnson 72, it ranges between 67 and 72. They are all actually considered very efficacious. All you need for a vaccine is to achieve 50%. So they are pretty good. Okay. Next slide, please. So I'll jump right into the side effects. Of course, for every drug, there's going to be a side effect. It's going to work, but of course, side effect doesn't mean you are not going to get it, and it doesn't mean you are guaranteed to get it either. It may or may not happen. So these are a list, and that doesn't mean it will happen, but chances are in the vast majority, it does happen. So just to make you aware, you may have some fever, some chills, and these are usually normal with most vaccines, nothing specific to COVID-19 vaccines. You may have a reaction, maybe redness, pain, irritation, and that's still normal. You may feel a little bit more tired than usual. You may develop a slight headache. You can take some Tylenol for that. Joint pain, muscle sores. Wait a couple of hours and you can take some medicine. But the goal here is to achieve that. We want to make sure that these vaccines are actually active. So I know some doctors would recommend, oh, take Tylenol before a vaccine. You really do not want to do that. So do not pre-medicate. Don't take Tylenol or ibuprofen or Benadryl before a shot. Please do not. Because then you actually limiting the activity of the vaccine, okay? Next, please. So the difference between a side effect and an emergency. So side effects are normal things we see. And emergencies, or the big word, anaphylaxis, is when you cannot breathe, when you have facial swelling, when developing a rash that should not be there. Oh, I'm getting too dizzy, I'm too faint, I cannot stand. Then now we have a problem. So that's a sign for anyone around you, or if you are capable, to make it to the hospital or call 911. Make it easiest. I do have a virus. So virus is usually information about the vaccine. Usually when you receive a vaccine, you should receive also a handout that tells you much. It should give you much knowledge about the vaccine, what it is, how it works, what the goal is, what to report. So that's usually a handout. Be safe. It's new. And it's pretty new. It's electronic, and it's of course the cool way of this generation keeping up with things. So it's an app that we usually ask people to download, and it's actually great because once you download it and register after your shot, it's more or less like you having a nurse right by your side. If you think anything is wrong, however you are feeling, you just text them, they text you right back. If you think it's an emergency, they'll actually give you a call back right away and give you guidances from there. The other thing about that is, please, we are finding out that people are actually trying to schedule shots on using the app, and that is not the goal of it. Please do not make vaccination schedules on that. That is not the goal, please. So as I mentioned again, any unusual side effects, please do report, because not only is reporting helping the patient, reporting actually helps to make the vaccine better. So it helps the manufacturers to alter things if they have to, so that the next person doesn't have to suffer. And it helps with data collection, just for future purposes. Okay. Next, please. So this is more about the V-Safe. If you do go online on the CDC website, it tells you how to download it. You just go into your if you are a Google user, your Google app, it comes out, and it's just really easy with the directions as to sign up. And you can sign up more than one person in a household. So it's a really good tool. I advise that we all make good use of it. Next, please. Okay, so one may ask, what if I take the COVID vaccine? What about my other vaccines? So the general recommendation now is to actually separate your second. If you do receive Pfizer or Moderna, please wait till you have received both of your shots and wait another 2 weeks when you are fully immune to go for any other vaccine, okay? And if you happen to receive another kind of vaccine for another illness or condition prior to your COVID shot, wait at least 2 weeks to 4 weeks to receive your first dose of COVID-19 vaccine. So there is a component of the vaccine that actually is sugar, and it's just table sugar. I know some diabetics might be worried because I've had a patient ask me, what exactly is in this thing apart from the vaccine? So we do package vaccines with other components to help delivery. And I had to tell the patient, well, it contains some sugar and it contains some lipids, which is fat. So just a side note, if you're diabetic, that table sugar is not enough sugar to alter your blood sugar levels. So just a word out there. And for those with hyperlipidemia or high cholesterol levels, that's not enough fat to throw off your levels on the panel either. So for pregnant women, we do not recommend it. For children below the age recommended, so 16 for Pfizer and 18 for the other two. For now, let's have our kids stay away until we have enough data in phase 4 to be able to test in kids and pregnant women. Next slide, please. Okay, that brings us to the end of the vaccines portion, and I'll hand over to Dr. Linn, please.
Thank you, Dr. Menza. Before we start, I want to just introduce Dr. Linn. He is a graduate, excuse me, of Marquette University with honors Phi Beta Kappa Alpha Sigma Nu. He is also a graduate of the Medical College of Wisconsin, and he currently is the Chief Medical Officer at Outreach Community Health Centers. Now, Dr. Linn has 3-4 pages of items. I'm not going to read them all, but Dr. Linn, if you'd like to mention your philosophy as it relates to medicine, that would be awesome. So I turn it over to you and welcome.
Great, and thank you. I'm pleased to follow those excellent summaries of the science of the virus itself, and also the issues regarding the basic ABCs of the vaccination. My basic philosophy is to make sure that everyone in Milwaukee has access to high quality, balanced, fair healthcare. And what I wanted to focus on as I talked today was some of the challenges we've had during this past year in dealing with COVID. And those challenges have, I think, led to people not being as confident as I'd like them to be throughout our community, including everybody in Milwaukee County. And I'll go back to when there's 4 things that I think have contributed to not fully confident in what we have to say. One is when the pandemic first started, patients were advised to stay at home and to ride it out, that they were better off not coming in because they were likely to get better at home. They didn't want to expose other people. The hospitals really didn't want to become overcrowded. They didn't know how to handle the virus. So what happened, even the paramedics, they've got like a card that tells them when a patient has this, bring them to the ER. Well, they were finding that when patients had all those things, there wasn't a spot for them in the ER. So they'd put them on oxygen at home, do things, but then patients were arriving very, very ill to the hospital and then getting in. And if they got in really sick, late in the disease, guess what? They didn't do very well in the hospital. So I think we've learned from that if we catch it before a patient gets too sick, we're going to do better. But that took us a number of months to figure out. The other thing that happened is once people got in the hospital, because it was a new condition, the doctors and the nurses, and again, I mentioned the nurses because they're the ones doing the day-to-day 24/7 contact with the patients. They had to learn different techniques to deal with the illnesses that they were facing. This was a new condition. needing application of old methods of treatment to a new condition. So they were learning on the job. And they were also fatigued, worried about getting it. Patients who went in the hospital, well, guess what? If I'm in a ward with 6 other patients who've got the COVID, how do I know if I'm going to get the COVID? So there was a second lack of trust. The third one was the mixed message that people got, because they would see some people's wearing a mask, some people aren't, some people are hanging out close together, some people are keeping their distance, and you'd see it on TV with different behaviors, and it just created all this confusion and lack of, well, who do you trust in this? So to me, trust has been something that it's taken a while to develop, but I think now we're at a state where we know much more than we did before, and we're thinking straighter, and it's not so emotional, and so we can get our message out better. The other thing is, I've got children, nieces and nephews, some grandchildren. Well, they're kind of cavalier about this because they know if they get it, they get it. They're going to get better. Why should they follow the rules? And so that's been another challenge that I think we've had to work hard to overcome. But I see people, if you will, following the rules or following the protocols much better. And that leads us now to, how do we figure out the best way to control the virus? And the vaccination turns out to be a wonderful thing. If you look at the development of it, there was a lot of your guys' tax dollars that went to the drug companies to develop the virus vaccination really fast. So people also didn't have all that much trust in that. But if you study it hard, there were plans for this type of vaccination or vaccine developed over the last 8 or 9 years, where they could plug in the exact identity of the virus to a vaccine, and then it would work for this particular virus, even though it wasn't even known yet. So that the development, although it's been super fast, and to me, awesome how fast, it also was based on a lot of scientific studies that were done ahead of time. There's also been a little bit of lack of trust because of other vaccines that were developed. The polio vaccine, which I got as a kid, there's 2 things about the polio vaccine. When it was first developed, it wasn't all that safe. It actually caused some polio in some people because they hadn't figured out that this live virus that had been, they call it attenuated, some of its activity knocked out, was not the safest thing in the world. But the vaccine we're giving now is never been alive, so that it can't do that. The other thing we had to learn, when the polio vaccine was given in the 50s and 60s, that affected mainly children. And there weren't all these rules and regulations. So the schools were the place everybody got the vaccine. You just line up in the school, you go to the gym, and they've got a few curtains up, you put out your arm, and you get the shot. A year later, they had a new polio vaccine, no more shots, just a sugar cube that you take. But we don't have that ability now to deliver it in that nice way in the schools. And the coronavirus, it doesn't have any favorites as far as age. It can affect everybody. So those are some things that once you understand some of that stuff, then you can hopefully trust things a little bit better. The way we get in the state of Wisconsin is based on all the people in Wisconsin. And it's also based on which group you fit in. So they started out with older people and people who were living in nursing homes. Well, the state of Florida has tons more older people percentage wise than we do. State of New York, tons more older people. So they got a lot more vaccines. Some people traveled from Wisconsin down to Florida, people over 65, so they could get the vaccine there. So we were a little bit short of the distribution cycle because it first went for older people. And the people doing the delivery, then they learned, well, we got to be fairer. So we're not going to focus so much on that. And then it goes from the feds to the state of Wisconsin. From the state of Wisconsin to the Milwaukee area, it goes to Freighter, and Freighter distributes it along these, Freighter's the hub, and it distributes it out to us here once a week. And we've tried to focus our vaccinations on the groups that are at risk most. i.e. for us, it was the patients over 65. But if you think about it, if you're 63 and say it's a guy who served in Vietnam, bad diabetes now, lost a leg in the war, had a stroke, boy, oh boy, if that guy gets it, he's going to be much more likely to get very sick than somebody who's 70 years old and healthy as a horse. So that we've tried to be a little bit creative. If there are patients who meet the criterion of having a lot of risk factors and they're already at our clinic, say, seeing Dr. Boateng, and they're appropriate to get the vaccine, we'll squeeze them in. The other thing to understand is that there are 2 more groups coming up that I think it's important for everybody to get the word to. School teachers are eligible, but the ones coming up are really hard to define. They're food service workers. Well, in my view, the people who work in food service are grocery stores, gas stations, convenience stores, restaurants, fast food places, coffee shops, food pantries, meal programs, and on and on and on. And we do not at outreach require any proof from somebody of the fact that they work one place or another. We will ask them to sign their name and where they work. We trust people, mainly because we want them to get the vaccination. So that's, those people are start to be eligible next week, Monday, or 3 days from now, 2 days from now. Starting the 1st of April, the next big group are anybody with any chronic diseases that you can think of. If you've got asthma, if you've got bronchitis, if you've got had a stroke, kidney disease, emphysema, high blood pressure, heart attacks, diabetes, HIV disease, if you're on prednisone or other steroids because your immune system's out of whack, if you're overweight, if you're pregnant, if you're demented, you are eligible for the vaccine. And I always tell young people that it's very important that you take this message home to all the people in your family, all the people in your circle of friends, to educate them. We will give you the info, but bring it to other people. Because once they get it, it really makes a change. We have a wonderful young lady who does the screening at our clinic at the front door, so nobody gets in the building who might have COVID. And she's got 2 kids and she lives with her grandmother. And she was kind of hesitant about getting the vaccine. And I try not to bug people. I try to bring it only up twice a day to her. But she went out of her way to bring her grandma in to get her grandma vaccinated. And she made my day last week when she got herself vaccinated. And again, no preaching to her, just talking to her. We have to talk to each other. The level of virus circulating now in the community is really low. And so this is a good time to whack it and just get it lower and lower so it just goes away. And to me, the best way to do that is to keep following the rules about distancing and masks and just being careful. And then to really study hard and come to the conclusion of what's best for you and your family and who you have contact with as far as getting the virus. That's what I have to say.
Thank you, Dr. Linn. Appreciate all the information that everybody has shared. I want to go back. I'm going to ask questions on behalf of some of the people who signed up. Sherelle Lawrence, I see you there. So if you have a question, I will read it for you. But I want to go back to Dr. Linn for just a second and ask specifically, if someone is wanting to get the vaccine, they can in fact walk into your clinic and get it, or do they have to be a patient there?
They do not have to be a patient here. We try to serve the patients who are affiliated with our clinic. And I use the word affiliated on purpose because if somebody's grandmother is not a patient here, but their child is working here, that to me is affiliated.
Okay.
You can't just walk in because that's a great question. We get a set number of vaccine doses every Tuesday from the state. We're never sure how many we're going to get. We request them the week before. So we actually have a waiting list that we put into action starting